This talk's called Communicating Corona, and it is a case study of reader accessibility about COVID-19 in Australia and Denmark, in healthcare material about COVID-19 in Australia and Denmark. And my name is Ida, and I'm a PhD student at Griffith University in Brisbane. See my slides. There we go. Okay, so I just want to say first off that this case study is a work in progress. And that means that it's still being developed. I haven't quite finished it yet. And because of this, feedback and comments are really greatly appreciated here. Hopefully this study will become an article that I'm working on, and it'll also probably form part of my PhD, which looks into minimal English for public health communication about infectious diseases. And I also just want to make a quick note on the ethical aspect of this. So obviously, COVID-19 is a very serious illness, and it's obviously affecting all of our lives right now. And that is why we're all virtually here and not meeting sort of face to face. So it's obviously something that's affecting all of us. And I do not take this issue lightly at all. And I also do not intend to make light of the matter. So I have had thoughts about whether evaluating and critiquing public healthcare materials, which have been published by people who are working around the clock and who are working really hard to ensure public safety, whether it be bad taste to be critiquing them and analyzing them. But at the same time, I think that this is what science does, right? We look at the things that consumes us and that are around us and that interest us. And in the middle of all this sort of madness that we're experiencing right now, it has felt quite meaningful to me to continue to develop this project. But I just want to say that I do acknowledge the seriousness of the situation, and I really don't intend to make light of it at all. So, starting off, COVID-19 is a global pandemic per the 11th of March 2020, and that is as defined by the World Health Organization. And because it's a very infectious disease, and the fact that there's not currently any known cure, communicating effectively to the public is really a key task here. And at the heart of this for healthcare authorities is the possibility or the probability of creating reader accessible healthcare materials. So you want to try and create materials that are as accessible to as wide a part of the population as you possibly can. And so for my theoretical framework, I'm drawing mostly on the insights of cognitive semiotics and NSM and minimal English. So in terms of cognitive semiotics, in this study, I situate public health posters as polysemiotic communication. And I do this because these public health posters that I look at, they employ both text and pictures. And so they use both the semiotic systems of language and depiction or pictures. And that is what we can call polysemiotic communication, multiple semiotic systems in combination. And I approach my analysis from the perspective of natural semantic metalanguage and minimal English. And that means that I'm adopting the view that ethnobiases should be avoided and effective communication can be done using simple cross-translatable words. So for my materials, I've used 2 materials from each country, so 4 in total. From Denmark, those materials is an infographic and a poster. And from Australia, it is 2 posters. And all of these 4 are centered around 2 key topics. So first off, how to prevent getting coronavirus or how it spreads. And second off, symptoms or how to know if you have coronavirus. And these 4 materials represent a snapshot in time. So they're all downloaded on 1st of March 2020. And this is obviously because at the moment, advice and facts around coronavirus is really changing by the day. So in order to make this case study, I really had to just settle on a time restriction. So all of these materials are what was publicly available on the 1st of March 2020. And I can say that both countries did have confirmed cases of coronavirus at this time, but also that these posters and infographics have changed since then. And again, as I said, I cannot legally show you the Australian posters, so I've sent you the links. And even though they've been revised since 1st of March, they're not revised in a way that's going to conflict with anything that I'm going to say. So it should be all right. And so for my method, I set out to analyze each set of material in detail. And in this analysis, I focused on accessibility and cross-translatability. And I also focused on the linguistic and pictorial interplay. So how pictures and text worked in combination and whether they worked in isolation from each other as well. I then compared the Danish and Australian materials and looked to see if there were any aspects that pose a barrier for accessibility and cross-translatability that they all share. And I found that these health materials across the two countries do share some aspects that could cause problems for accessibility and cross-translatability. And first off, I found that pictures can be misleading without the corresponding text. I also found that the intended message of a picture can be hard to interpret, even if it's not ambiguous in a problematic way. I also found that these healthcare materials sometimes use words and constructions that are highly language specific, which means that they could be alien to someone who are not yet fully proficient in that language. And it also means that it could cause troubles if potential translations were needed. And lastly, I found that these healthcare materials do display some confusing organization of ideas. For instance, many distinct headings or multiple distinct ideas presented in the same panel. So to illustrate this, we can start with misleading pictures. So here I have the infographic, which is authored by Sundhedsstyrelsen, which is the Danish Health Authority. And over here to the left, we have some symptoms of coronavirus. And if we look to the leftmost picture, this picture is accompanied by the text hoste, which means cough. And it's obviously accompanied by this picture, which is supposed to communicate cough, but really looks quite a lot like a breath or a puff of air. And this could give the impression that the act of breathing or anything to do with air has something to do with the symptoms of coronavirus, which is an interpretation quite contrary to what was intended. And I think it's important to note also that breath can be visible like this and look quite a lot like this, particularly in a country like Denmark, where around the 1st of March, it can still be quite cold. So if you go outside, your breath will be visible like this coming out of your mouth. So yeah, so that it can be some examples of pictures where they communicate something other than what was the intention. In terms of complex language, in the Australian poster, which I can't show you here, they have some descriptions of symptoms of coronavirus. And some of those descriptions are sore throat and shortness of breath. Now, both of these are quite idiomatic expressions of English, and they could both be quite alien to someone who has limited English, and they could also cause difficulties in translation. So if we consider Danish as an example, if you directly translate sore throat into Danish, it would mean that the skin, sort of the skin around the neck, is tender and sore and wouldn't actually have anything to do with having pain inside the throat, at least if you do a literal translation. And shortness of breath would just sort of be nonsensical in a language like Danish. And these kind of problems would be evident in some other languages as well. And lastly, for organization of ideas. So in the Australian poster, there are multiple distinct headings. So there are about 4 distinct headings throughout the poster. And it means that it's a little difficult for the eyes to navigate and to know which is supposed to be the most salient and important aspect, which means that the poster is more difficult to navigate for information. And in the Danish infographic, we see that there are multiple distinct ideas in the same panel. So we have these different ideas. So over here, it has to do with preventing spread of the disease. And to the left, it's about symptoms and if you're sick. And they are 2 distinct ideas, but they're presented in the same panel with sort of no distinct barrier between them, which again can make it hard to navigate for information. So considering these issues, what can we do about this? What can we do to increase accessibility and cross-translatability in public healthcare materials such as this? How do we alleviate some of these problems without compromising the quality of the healthcare message? So this is really important questions, right? Like we must not compromise the quality of the healthcare message. And lastly, how is it possible for us to optimize a healthcare message for users with limited proficiency in a language without at the same time alienating native users? So I want to say that I don't think there's any easy solution to this, unfortunately. And it's a really big challenge for health authorities in general to communicate about diseases, but particularly in times of COVID-19, the science and the facts around corona just keeps changing. It changes by the day, right? So there's kind of no static truth for these public health authorities to work around. And there's also immense pressure on them to produce this material and produce it fast. This is kind of this idea that Cliff also talked about with emergency linguistics, right? They have to put out accurate information to ensure public safety, and they have to do it fast. So of course, it's really difficult. It's a gigantic challenge for them. And to illustrate kind of how difficult this is, we can consider what a cough looks like. So a cough, I would say, is for the most part invisible. We recognize a cough by the bodily movements that people do when they do it and what it sounds like. So over here we can see this is a snapshot from the Danish infographic again, sort of showing a cough or a sneeze by part of the face being covered by an arm. That's the way they represent that. And that's the way it's represented in the Australian poster as well. They have just the word cough and then a person covering part of their face with their arm. But even these bodily motions differ depending on culture, but also depending on the individual. So some people might not cover their cough, or they might cough into their hands. Hopefully we don't see so much of that anymore these days, but people can still cough into their elbow or into their shirt. So it's really no wonder that choosing an accurate visual to present a cough can really be quite difficult. I want to note though that having a picture that's a little difficult to interpret, kind of like this on the left, without the corresponding text, this text says cough or sneeze into your sleeve. Having a picture that's a little difficult to interpret without the corresponding text is not as problematic as when you have a photo that communicates something quite contrary to what was intended. And this is because even though these pictures might have been intended to be viewed in conjunction with their corresponding text, this is not always the case, because someone in the community, whether it be because of literacy barriers or language barriers, might not have access to the text and as such rely wholly on the picture for their information. So if the picture is communicating something quite different than what was intended, this can cause some problems in understanding, right? So I suggest that part of these issues, at the very least, can be addressed when we apply minimal English to public healthcare materials. I tentatively suggest calling this medical minimal language. So this idea of using minimal English for healthcare was first discussed by Diget in 2018, but it is as of yet unexplored for public health messaging. So adopting minimal English to public healthcare materials means adopting this view that that which is easy to translate will also be easy to read. And this is partly because it'll rely majorly on concepts that are shared across most or all languages. And this also means that it'll be more accessible to someone in a community who has limited proficiency in the target language. It's also important to note that if we author public healthcare materials in a way that's optimized for translation from the beginning, it'll make the translation and distribution process more efficient as a whole. And this is important to note in COVID-19 times, because right now, every linguistic community, kind of regardless of size, needs information about this disease. So translation processes are very real right now for public health authorities, and particularly in a country like Australia, where there's many smaller community languages. So you might ask, why is it better? So why is it better to use minimal English for public health messaging than it is to use existing guidelines of use plain language? Because many health authorities do already recommend using plain language. And that's pieces of advice such as use easy to understand words, use short sentences, etc. But I want to suggest that employing NSM-based insights from the start, NSM-based or minimal English-based, may help shed light on readability and accessibility problems in a way that plain language guidelines just don't allow for. So to illustrate this, we can consider these two from before, the sore throat and shortness of breath. So we saw that both of these can cause problems for cross-translatability. but they would probably both be acceptable using guidelines of plain language because they're not particularly complex and they would be quite familiar to native speakers of the language. Also, it's worth noting just quickly that because of this genre, a poster, space constraints are a real issue and they do complicate things. So we don't have the option of just substituting these symptoms for a text where we describe what we mean, because you do have to keep it sort of short and sweet, as is the case here. Now, bearing that in mind, shortness of breath, this kind of quite idiomatic way of talking about the symptom in English, can probably be substituted by something else. World Health Organization has this symptom down as difficulty breathing. And difficulty breathing, while it might not be particularly more desirable than shortness of breath from a plain language perspective, because it doesn't use shorter words or is obviously less complex, from an minimal English perspective, it would probably be easier to translate just because it uses concepts that are a little bit less sort of English specific and idiomatic. So for comparison, we can compare that in the Danish material. This symptom is called breathing problems. Now for sore throat, this is kind of a bit of a different challenge. And that is because sore throat is the most common and accepted way of talking about this symptom in English. And that means that it probably cannot be substituted by something else without alienating the native speakers. So if we consider throat ache or throat pain, that'd be great for translatability, but it's not a very familiar way for English speakers to talk about this. Even if they are able to understand it, it would still sound alien to them. So we see that in the process of applying minimal English, we get to go into detail with these things and why some things might work for accessibility and why other things might not, which we couldn't do if we were simply using plain language guidelines. Now, lastly, I just want to make a quick note on the accessibility of pictures. So I want to suggest here that using these insights and ideas of NSM and minimal English can be employed to pictures. And as an example, we can consider the medical cross as pictured here. Now, the medical cross is used in the Australian poster together with the text, "Call your doctor." So it's meant to denote "call your doctor" here. But it could also mean, just the symbol of the cross could also mean hospital, first aid, pharmacy, the Red Cross, anything other related to medical services or something not related to medical services at all. So we see that this symbol might not be completely cross-translatable or accessible to everyone in a community because at the very least it has distinct interpretations, multiple distinct interpretations. Of course, in the sense that it's trying to broadly just communicate medical attention and that being just within the context of the Australian society, this picture is not in itself problematic. But it does have multiple distinct interpretations, which could differ depending on culture. So we see that when we follow the principles of minimal English, it means that we have a heightened awareness of that which is shared across cultures and languages and that which is not. And it means that we get to choose options that are accessible to the widest range of people when possible. And this principle can be applied to pictures as well. So in conclusion, in surveying these public health materials, I found that these materials have characteristics that may complicate reader accessibility and cross-translatability. I found that these challenges are pictorial, linguistic, and organizational. And I suggest that employing insights from NSM and minimal English may help address these challenges, at the very least linguistically. But I also suggest that these insights may even be able to shed light on accessibility and translatability in pictures. Thank you very much. I also have some references, which we can share these slides later.